Welcome back to part 2 of our mild debarquement study done by Mount Sinai in 2014. Today we're going to discuss how to make the treatment in this study happen in real life. If you haven't watched part 1 where I discussed what the study is itself, I linked it below. My name's Amy Moore. I'm a vestibular physical therapist, which means I treat dizziness and balance conditions such as mild debarquement for a living. The basic premise of the treatment performed by the researchers is that they determined the frequency and direction of the person's rocking, and then they applied a visual stimuli to that person while they moved their head passively, meaning someone else moved it while they looked at the lines for 3 to 5 minutes per session, 1 to 8 sessions per day for at least 5 days in a row. So let's break down how they did it and maybe some tips about how we can do it in a real PT clinic setting. First of all, let's define a couple of terms. Because every mild debarquement patient is different and what they're feeling is different, we have to define each person's individual frequency of rocking and direction of rocking. The frequency means how often they feel a swaying or rocking sensation. And that frequency will be put into beats or sways per minute. The direction of sway is a little trickier because most mild debarquement patients feel two different motions. They feel swaying to the right and then the left, or forward and then back. So it's hard to determine which of these are predominant. However, the theory is that the person is actually feeling that their center of gravity is being tipped to one side and that the correction is the feeling of sensation to the other side. So how did the researchers determine these things? They used 4 pieces of data to determine the patient's frequency and direction of sway. First, they used an accelerometer strapped to the patient's wrist, and the patient moved their wrist in the frequency of the sway. Second, they used posturography, and this wasn't really that fancy. They used a Wii balance board, and the Wii balance board with the patient's eyes closed for 2 minutes told the researchers if they were being pulled forward, backward, right, or left. Unfortunately, people who felt bobbing up and down demonstrated very little posture sway. Third, they used nystagmus. They used those dark video nystagography glasses to be able to measure the patient's pupillary responses whenever they tipped their head to one side or the other and determine if the eyes were darting to one direction consistently. And fourth, they used a balance test called the FREQUNCY step test, where the patient closed their eyes, put their arms out forward, and marched for 1 minute. If they rotated more than 20 degrees to one side, that told them what side they feel that they're being pulled to. And I think it's important to note that after all these very specific and very sophisticated tests, that the researchers didn't have any consistent reportings or any consistent findings amongst the entire population of patients for all 4 of these tests. So they had to take all of the data they had on each person and make a decision. And in some cases in their patient population, they were unable to determine what the direction of sway is, so they had to try the treatment one way, and if it didn't work, they just had to switch the direction. It just goes to show you that even when we try to be perfect with vestibular disorders, there's no way to really be perfect with every single person because every person is different. So how can you determine your frequency and direction of sway so that you can select the correct treatment? Well, most PT clinics don't have VNG goggles, posturography, or wrist accelerometers, but what we can do is use the patient's subjective by having them write the movement on a piece of paper. Have the patient close their eyes and write waves up and down on a piece of paper or left and right on a piece of paper. Then count the number of waves and divide it by how many minutes you observed for. You can also use a Romberg test, which is having the patient stand with their feet together and their eyes closed and observe for different directions of sway. You can also do a FREQUNCY step test, which is eyes closed, arms out, and march in place for 1 minute to see if they rotate one way or another. I recommend doing multiple different sessions of this and averaging everything together. Make sure that you get a good, well-rounded set of data. And if all that fails to give you a conclusive result, my suggestion is to ask the patient. They probably have a pretty good idea of what direction they feel that they're being predominantly pulled in and how frequently they feel sway. And now that you have your frequency and direction of sway, you can apply your treatments. Go to part 3, where we'll discuss how to apply these treatments in a real PT clinic.